Hi everyone, welcome back to my YouTube channel, and today we are going to talk about menorrhagia. And let's start our topic with introduction. Menorrhagia is defined as excessive or prolonged menstrual bleeding. It is one of the most common gynecological problems and can cause significant women physical health, emotional well-being, and quality of life. Menorrhagia is diagnosed when menstrual blood loss exceeds 80 milliliters per cycle or when bleeding lasts longer than 7 days. Causes of menorrhagia. It includes structural causes or non-structural causes. Structural causes include uterine fibroids that are leiomyomas that are benign tumors that increase uterine bleeding, endometrial polyps that are small growth in the uterine lining, adenomyosis that are endometrial tissue growing into the uterine muscle, and malignancy that is endometrial cervical cancer. Non-structural causes include hormonal imbalances that include involuntary cycle, PCOS, and thyroid disorders. It includes bleeding disorders like von Willebrand disease and platelet dysfunction. It includes medications like anticoagulants, hormonal therapies, and intrauterine devices. It includes endometrial dysfunction like abnormal response of uterine lining without structural abnormality. And there may be idiopathic cause that has no identifiable reason despite evaluation. Risk factors include adolescents with ovulatory cycles, women approaching menopause, family history of bleeding disorders, obesity and metabolic disorders, use of certain medications like anticoagulants. Symptoms include heavy menstrual bleeding requiring frequent pad or tampon changes, menstrual bleeding that lasts longer than 7 days, passage of large blood clots, fatigue and weakness due to blood loss, and symptoms of anemia. Diagnosis is done by clinical evaluation and investigation. Clinical evaluation includes detailed menstrual history, including duration, frequency, and amount of bleeding. Physical examination for like pelvic exam. Investigation include laboratory tests, that is CBC to check anemia, thyroid function, coagulation profile, and hormone level. Laboratory investigation further include imaging like transvaginal ultrasound and sonohysterography. Investigation also include endometrial biopsy, that is to rule out hyperplasia or malignancy. And it also includes hysteroscopy, that is direct visualization of uterine cavity. Complications include iron deficiency anemia, reduced quality of life due to chronic fatigue, infertility, and increased risk of endometrial carcinoma in some cases. Treatment include medical management and surgical management. Medical management include hormonal therapy that has oral contraceptives, progesterone, and gonadotropin releasing hormone. Non-hormonal therapy that include NSAIDs that reduce prostaglandins and tranexamic acid that are antifibrinolytic. And iron supplementation are also given for anemia correction. Surgical management include hysteroscopic polypectomy or myomectomy, that is removal of polyps or fibroids. It also includes endometrial ablation, that is for destroying uterine lining to reduce bleeding, and hysterectomy, that is definitive treatment in severe or refractory cases. Prognosis. With proper treatment, most women experience significant improvement in symptoms. Prognosis depends on the underlying cause, but early diagnosis and management prevent complications such as severe anemia and infertility. Conclusion of this lecture video. Menorrhagia is a common but serious gynecological condition characterized by heavy or prolonged menstrual bleeding. It can result from structural, hormonal, or systemic causes. Diagnosis requires careful evaluation, and treatment ranges from medical therapy to surgical intervention. Timely management improves quality of life and prevents long-term complications. And this was all about menorrhagia. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.